Good morning, everyone. Thank you so much for joining us. My name is Darian Jones. I'm the Caregiver Education and Digital Specialist here at Care Partners. During this time of social distancing, we are providing hot topic live segments on our YouTube and Facebook page. We're also creating more resources on our caregiver blog, and we also are continuing to monitor the coronavirus situation. So be sure to check out our website for more information on that. We're also offering teleconference common ground twice a week. So you can just call in and it's a caregiver support group. So be sure to go to our website for more information on that. But today this morning, we have a very special guest. He's going to share with us how to navigate the maze of Medicare. So today we have Bill Hildebrandt. Hi, Bill.
Good morning.
So can you tell us a little bit about yourself and what we're going to be talking about today?
Sure. I'm Bill Hildebrandt with IMG Insurance. It's just one of the many agencies that work with Medicare. I've been working with Medicare for 10 years and really enjoy the contact with my clients and helping people understand Medicare. I think is a lot more important than someone trying to get you to purchase something. I think understanding all the aspects of Medicare is actually more important, and that's what I like to do is educate people on how all this stuff works.
That's great, and it's such an important topic, and honestly, kind of dense a little bit. So we really appreciate you here, kind of helping us navigate through it.
Sure.
With that, I'm just going to let you take it away, and we'll go ahead and get started.
Okay, great. I've got a list of specific topics I'm going to talk about, and if you have any questions, please feel free to put those in the chat box, and Darian's going to help me with that after I'm finished. Hopefully I can get to all your questions. This really isn't designed to answer every single question that comes up about Medicare. It's to give you basically a springboard as to what's out there and how things work. Some people are pretty concerned about how this is going to affect them, if everything just turns on automatically, or what do they have to do. And the main thing is don't worry, just be part of the system, just kind of understand what's going to happen. And if you have questions, you can always contact Medicare themselves. You can contact an agent, you can contact me, you can contact Darian. But the first topic I want to talk about is what Medicare agents are and what they aren't. Medicare agents are state licensed health insurance agents that are contracted with specific private insurance carriers to provide products that work with Medicare, such as Advantage plans, supplement plans, and prescription drug plans. Agents are prohibited from charging marketing fees. That's kind of open to interpretation, but to me, that means my research, my recommendations, my time, and my mileage to come see a client are all free. Agents can't put flyers or business cards on your front door or on your windshield. Medicare beneficiaries are actually a protected age group. And due to that, there's a lot of things that agents are not supposed to do. We're not supposed to make what's called an unsolicited outbound call. So that means if your phone rings and it's a Medicare agent, they better just be calling to see how you're doing. They might confirm that you're turning 65 and you're eligible for Medicare, but they had best not be calling you to try to set up an appointment to talk about Medicare Advantage plans or Medicare prescription plans, because those actions are prohibited by CMS. CMS is the Centers for Medicare and Medicaid Services. Those are the folks that actually regulate and monitor and administer the Medicare program. When you get something from an agent, whether it's me or anybody else, it's going to be the same price as if you got it yourself, or if you got it online, or if you got it from any other source. The reason for that is Medicare they don't need price wars. They don't want you to get something from a person and then find out you could have gotten for $5 a month less from somebody else, and then you cancel your current plan, and now you're waiting for the next plan to activate. In the meantime, you might actually be without coverage. So the government doesn't want that. They don't allow that. So you might already know that when you see a price on TV or you hear a price from an agent, those prices aren't just similar. They're identical. They're supposed to be identical. There's not supposed to be any difference in cost. Now, agents do get compensated if somebody purchases a product, but that compensation is not reflected in the premium whatsoever. And so I just wanted to mention that. Some people wonder, well, where do you get paid, and do I need to pay you, and how does that work? And the answer is, you don't owe an agent anything for their time or their research or their recommendations. We're just here to help you, and if there's anything we can do, we're here to do that. But there's no price wars. There's not going to be any difference if you buy it from one agent or another agent, or if you get it directly from Medicare or from the carriers. My second topic is the origin, structure, and cost of original Medicare. The Medicare program was established in 1965 by the federal government for U.S. citizens and permanent legal citizens who have been here for 5 years or more. It only has two components. Now, some people think it has several more, but there's really only two components to original Medicare. There's Part A, which covers inpatient hospital care, skilled nursing care, hospice, lab tests, surgery, and home health care, and Part B, which covers doctors. Part A does not cover long-term care or custodial care, routine dental and vision, or hearing aids. Part A is free for most people, but if you had to pay for it, it would cost up to $458 a month. The reason that Part A typically doesn't cost people anything is because they've already paid, they or their spouse have put taxes in, Medicare taxes, for 10 years or more from their employer. So if you or your spouse have worked for somebody for 10 years or more that took out Medicare taxes, then your Part A is already paid for. If you moved here from another country, or if you didn't have employment with somebody who took out Medicare taxes, then you would have to pay something, possibly up to as much as $458 a month. Part B, the doctor side of Medicare, covers medically necessary services and preventive services such as treatment you would receive at a doctor's office. Everybody pays for Part B, which starts at $144.60 a month, and it can cost more based on your income from 2 years ago. Original Medicare pays on average 80% of your healthcare costs, of your hospital and doctor costs, and you pay the other 20%. It is excellent health insurance, and that somebody other than you is paying for 80% of your healthcare cost. Compared to being completely uninsured, that's huge. There is, however, no ceiling or cap to what your 20% could be. So if you're just going to the doctor a few times during the year and you're not hospitalized and you're not having any surgeries, your 20% could literally be less than $300 or $400. It could be even less than that. But if you're admitted to the hospital for pneumonia, or if you have to have a major operation, your 20% is now suddenly 20% of a much higher number. So there is no ceiling to original Medicare. Original Medicare does not follow you outside of the United States. Means if you go to Mexico, or if you go to France or Italy, or go to anywhere outside the United States, you actually have left your health insurance behind. Original Medicare stays right here in the United States. Original Medicare doesn't cover prescription drug plans, and they also don't cover routine dental or vision. Original Medicare, one of the biggest advantages to original Medicare is it has no networks, and referrals are not necessary. So that means you can go to any doctor, any hospital, any treatment facility in the United States that accepts original Medicare and get in without a referral. So that's pretty significant. Third topic is, do I have to sign up for Medicare, and if so, when? Well, you don't have to sign up for Medicare if your health care is provided by Medicaid, VA benefits, or group health insurance. It is not illegal to not have Medicare once you turn 65. But the reality is, at that age, it may be the only individual health insurance that you can apply for. And if you are late signing up, then Medicare is going to charge you what's called a late enrollment fee. Most people either sign up for Medicare within a 7-month window that's centered around their birthday, or within 60 days of losing group health insurance. Most people sign up for both Part A and Part B, but some people only have one of the two. A fourth point is what optional plans are available that would help me control my out-of-pocket expenses. This is in light of the fact that original Medicare doesn't include prescription drug coverage, and it also doesn't have a ceiling, doesn't have a maximum out-of-pocket amount. Medicare Advantage plans are sold by private insurance carriers and required at a minimum to cover everything that's covered by original Medicare Part A and Part B and have an annual maximum out-of-pocket limit or ceiling. They're very inexpensive. They're available in both HMO and PPO networks. An HMO is a health maintenance organization. A PPO is a preferred provider organization. They usually contain a PDP, otherwise known as a prescription drug plan, or Part D. Advantage plans are also referred to as Medicare Part C, although it's different than original Medicare. You must have original Medicare Part A and Part B to get an Advantage plan. And like I said, a lot of people think that Part C and D and some of these other letters are actually part of original Medicare, and they're not. The only thing that original Medicare has is Part A and Part B. A Medicare Supplement or Medigap plan doesn't take the place of Medicare. It covers some or most of your out-of-pocket expenses associated with Medicare, such as your deductibles, copays, and coinsurance. These plans are also offered by private insurance carriers, but at a higher rate than Advantage plans. Because supplement plans work with original Medicare, they are not limited to specific provider networks. They cannot include prescription drug coverage or routine dental or vision. You must have both Medicare A and B to sign up for a supplement plan. So the key thing here is Advantage plans are less expensive. They usually include dental and vision. They usually include prescription drug coverage, and they're very, very inexpensive, but they do require you to work with networks. Now, if you have a PPO network, that means you can go out of network and still have coverage, but you will pay more. Supplement plans cost more, but they have absolutely no networks. A prescription drug plan, or a Part D, is also available as a standalone plan for people with supplement plans and people who didn't sign up for both original Medicare Part A and Part B. So you can get a prescription drug plan if you only have Part A, or if you only have Part B. You don't need both to get a drug plan. Having a drug plan greatly reduces the out-of-pocket cost of Medicare beneficiaries. Another topic is, can I change my Medicare plan if I don't like it, and if so, when? Medicare beneficiaries can choose different Advantage plans or prescription drug plans each year during the annual election period, which runs from October 15th to December 7th, for a new plan that starts up the first of the following year. Advantage plans can also be changed during the open election period, which runs from January 1st to March 31st of each year, with the replacement plan taking effect the first of the following month. So if by January 15th or 16th or 17th you decide that you've got a Medicare Advantage plan that simply isn't working for you, you can change plans. You're not stuck in that plan for the rest of the year, which I think is great. Medicare supplement plans can be changed at any time of the year, although they are eligible for medical underwriting, which has the potential to make changing plans cost prohibitive. Most people that change supplement plans do so before age 70. That's not cast in stone or anything. That's just typically the time when you can change supplement plans, and it doesn't end up costing you more. Once you're in your late 70s or early 80s, chances are medical underwriting is going to find something that's going to let the carrier charge you a higher premium, which may make it inadvisable for you to change plans at that time. There are other times that people can change plans through a qualifying special election period, or SEP, such as when someone is covered by group health insurance past age 65 and then signs up for Medicare 65, signs up for Medicare when they lose that insurance. Another topic is, what happens if I move to another city? Does Medicare follow you? They don't automatically follow you. You have to notify Medicare that you moved. If you have an Advantage plan or a supplement plan, chances are you're going to need to contact that carrier and tell them you moved too. A lot of these plans are geographically specific, which means if you move out of the service area, you've lost your coverage. So you may have to notify them that you moved. They don't magically automatically know that you moved. Is there financial assistance available to help pay for original Medicare and the optional plans? The answer is yes. If you have got Medicaid eligibility, Medicaid can help you pay not only for your Part B premium, but some or all of your Part C premium, as well as other out-of-pocket costs. If someone is not eligible for Medicaid because they have too much money or other issues, they can still apply for low-income subsidy, also known as extra help, which is a program directly through Medicare, not Medicaid, but through Medicare themselves, to pay for some of their out-of-pocket costs associated with prescription drug costs. My closing comments would be original Medicare and the optional plans that work with it do a very good job of making individual health insurance affordable for senior citizens who otherwise might not be able to qualify for it. People who are getting ready to retire are often very concerned about how they're going to pay for their health care costs once they're on a fixed income. And I believe Medicare answers that question. Again, I'm just a Medicare agent who doesn't sell original Medicare, but I do have a good understanding of how the program works. Now, Darian, if anyone's got any questions, I'd be happy to try to answer them.
Let's take a look. It doesn't look like we have any comments yet, but I do have a question.
Sure.
If you had any advice for caregivers right now, what would your best advice be?
Because of the current situation with COVID-19, really because I'm not a caregiver myself, but I'm still working with clients. You've got to make absolutely sure that you're not the cause of transmission. I'm much more worried about the people I work with than myself. But the thing is, if you go into an environment where there's always a possibility that you could be spreading something, you've got to be completely clean with gloves or whatever protective gear you have. And as strange as it may sound, these days it may not be a bad idea to have a mask for yourself and a mask for whoever you're helping, just to make sure that in a week or 2 weeks from now, that if someone ends up with COVID-19, that you have absolutely clear conscience as to there's nothing that you possibly could have done to aid that transmission. And unfortunately, that's the only caregiver advice I have.
Well, thank you so much for being here and sharing this great information with us.
Well, sure. And if anybody has any questions, I think Darian has provided my contact information, and she told me that if you lose my contact information, you can also contact her. And again, agents don't charge anything for their advice or information. If you simply have a question about when I need to sign up, or do I need to sign up, or this is my situation, do I need to do anything at all, I would be happy to help you. And any agent should be happy to help you too.
Awesome. Well, thank you again. We are gonna close off for today, but as he said, if you guys need some help or additional information, his email is right up on the screen, and we'll also have a blog post up on our website later this afternoon. So be sure to check that out too. Thanks again, Bill.
Thank you so much for having me. Bye-bye.
And for the latest on Care Partners updates, be sure to head to our website. We'll be doing lots of great content and fun activities and things to do while you're stuck at home. So thank you so much for joining us today, and we'll see you back later this afternoon for a great at-home activity.
Yay.